Hi, everyone, and welcome to episode 11. We really appreciate the amount of people that we've had watching us. The numbers keep growing and growing, and it's very gratifying. And so we thank you all. So I am here today, Daryl Annisfeld, and next to me is Sandra Baskin.
Hi, everybody.
And underneath her, maybe, is Sandy Gulliver. And our guest today is Dr. Josie Tenore, who has been my friend for 20 years and is now my medical spa guru. And she has a magic toolbox that is absolutely amazing. And the most amazing thing about it is this is a non-invasive kind of thing that well, I'm going to let her explain. So welcome, Josie.
Thank you very much. So we have, luckily, there has been this huge trend away from having surgical procedures done. Although now during COVID, people are at home, and so there's a little bit of a blip back. But surgical procedures do address, certain aspects of youth and beauty. However, they don't necessarily address all of them. Think back in the day of, some viewers are not going to know who Phyllis Diller was, or because they just won't. But when she had her multiple facelifts, part of the why she looked so strange was because she didn't have volume, and so I like to give people, a visual to think about when we're dealing with, creating youth and beauty in a face, for example. I like to have people think about a dining room table where you've got, all the leaves are in the table, and the tablecloth is that nice, thick, plush foam tablecloth, and there's no red wine stains on it, and there's no hot chocolate stains on it. And when you have a very large table with this nice, thick, padded tablecloth, everything looks nice and fresh and large. And as we get older, the tablecloth gets, spills on it, and then it also gets washed a number of times, so it gets thinner, and we also start to lose some bone and fat and muscle. And so we really have to address all of those aspects when we're dealing with the facial aging, and so restoring facial aging. So we have treatments that improve the tablecloth, and then we have treatments that make the table bigger so that you can restore youth and beauty without necessarily having something cut. Does that make sense?
Cool way to put it.
Yeah.
Good analogy.
I like to say plastic surgery, they take the tablecloth off, they cut it, they sew it, and they put it back on. And so now you have a smaller table with a smaller tablecloth and a seam. And that's why, some of the older people, the older facelifts did not look natural. So those are just sort of how we look at the aging face, and so the tools that we use to address those areas. And Daryl's had a few of those tools.
Just a few. And it has been a progression. What I'm thinking about right now is how long it has taken me to go from procedure to procedure and trying to deny the fact that I just really wanted to look better. And saying that, what do you mean look better? Embrace your age and your beauty and everything like that. And it was like, this is really hard for me to say I'm more vain than what I had thought I should be. And as each procedure got more and more involved and more better, I think I've done them all. So
vain
but it has been
a bad thing. You say the word vain as if it's a bad thing. It's not.
No, I know. And it's accepting that too. It's accepting the fact that it's okay to want to look good, and it's okay to want to look just bright and not bright and cheery, and since I cannot have anything invasive, it was like, all right, that doesn't leave me with very much. However, my friend Dr. Josie has come up with a few.
The truth is we are living longer. And so, a lot of my patients either come in and say, I want to look as good as I feel, or I want to feel as good as I look. It goes both ways. So as we're living longer and longer, looking in the mirror and saying, who is that person is, difficult when you feel vital and you feel like you're full of beans, but the reflection back doesn't match. So, what I try to do is I try to make the reflection match more the visual of what the person feels like internally, so that it's just allows people to have a more vibrant, full life.
I
Well, the
think it's
fact that
also important, it's also important in our profession to look at.
I was just going to bring that up too. Yeah.
yeah,
Yeah, well, we can't,
There are-
we're actresses, we can't get rid of every flaw otherwise, because otherwise you can't, you can't do your jobs. But we can certainly, I think, there are roles for older actresses, but there are not as many as there are roles for someone who doesn't necessarily fit a particular age category. So it's nice to be able to let you fit into different age groups, I think, no?
Well, yes, you're right, except that the roles for older women are increasing.
Yeah, and we really don't want to try to fit into a younger category because that category is chock full.
Mm.
So we just want to look the best we can for our age category.
For seniors. Yeah, I think that was
Right.
60 and over, maybe.
And especially for commercials, because in our age group, we would be called in for a lot of pharmaceutical commercials. And
Yeah.
if you notice the women they choose, they always have a very youthful look.
So Josie,
and there are those of us who went, a little gray. Okay, yeah. I embrace that.
Yeah, there's nothing wrong with it. You have a great kind of gray, because it's, almost like there are people who spend a lot of money trying to get that color on their
oh, for sure. Yeah.
at a younger age. So if you if you have that nice gray, there's nothing wrong with being gray.
No,
Agreed.
Sandy's is also beautiful.
Everybody that I know that finally went gray said it was the best thing that ever happened to them. They get so many compliments. They say people say it makes you look younger. And I agree, because now your hair matches your natural skin tone. It was all designed to go together that way.
I stopped a gal on the street the other day and asked her if I could borrow her gorgeous hair for one of my auditions. Josie, sometimes they want specifically not only older, but gray or salt and pepper or white or something. And yeah, I have to use a wig, but she looked at me real funny to start with, but then she started laughing.
Well, this is part of this is I'm growing it so that I can donate it to children with hair loss.
Oh, well, that's a wonderful, wonderful thing.
But it's just a lot of hair, and I just needed
Boy,
it.
has she got a lot of hair.
Yeah, it was very thick.
Take you forever to dry it and when you get out of the shower, I'm sure.
Well, it's curly, so it's really shocking that it dries pretty quickly.
Oh, yeah. I understand about, curly hair.
So tell us everything Daryl's had done. She agrees.
Well, I'm not going to say everything.
Oh,
Look at Sandy's face.
Although I do joke, with all my patients, I said, no, you're actually paying me for psychotherapy. I just throw in the beauty.
Right.
So I think we have some before and afters. I think we have one. There's a photo where we've got, sort of Daryl, where she was, before we started doing much. And it's sort of, it's a 4-picture photo, and it's got sort of I guess over the years, really. So you've got on I'm always the left, right, because I'm so used to looking in cameras, so at the top left of the screen is before we did anything with Daryl. And she, really had, she's got beautiful skin now, but it was at that point just a little bit, I would say, UV and also pollution damage, which is what happens to all of us, and we now know that pollution causes a lot more damage to collagen and elastin than even UV. But, remember when we were kids, what did we do? We put aluminum foil on albums and olive oil in ours because we wanted to all be nice and golden brown, but it does break down the collagen, the elastin. So what you see between the top 2 photos is we did do some resurfacing, which is, it's not 100% non-surgical, because it's the skin does, we do remove the top layers of the skin and try to, even out the actual wrinkles or iron them out. Let's just say we iron them out.
Would you run that past us again? You removed the top layer of
the top layers of the skin. So so we do that with a laser, and lasers now are very precise. And I can customize it. So we also did what's called a laser bluff for her because she had a lot of hooding. you know, it looked like the bags under her eyes were a lot more pronounced. So we were able to do laser resurfacing above and below the eyelids as well. But with lasers, I can set my depth so that I know precisely how many layers I'm removing, so that I can, you know, be very safe in what I do, but also very effective. So wrinkles that are deeper, I'm going to go a little bit deeper. The skin that's a little bit more fragile, we're going to go a little bit more fragile. But ultimately, I've worked very hard at creating a healing protocol where I actually take people's blood and spin out red blood cells and white blood cells. And I place it on the skin immediately after the laser. And I use lights and certain products. And you know, even with a very aggressive resurfacing where most other offices, patients are out, you know, they're hiding at home for, you know, anything, anywhere up to 3 to 4 weeks, if not months. I get people healed in 5 days. 5.
Wow.
On one hand, you could put makeup on and go out, just because, you know, I think essentially what I do is I think of my own body, and I'm like, I won't put up with that. Like, okay, I'll give you 5 to 7 days, but I ain't going to give you more than that. So, you know, we were able to get her healed fairly quickly. And then the bottom left photo, we did some filler. And then the last photo you see, we did another procedure around her eyelids, because, you know, one round of trying to tighten up some of the eyelid skin wasn't enough, but she can't have surgery. And so, you know, each time we do a procedure, the skin tightens and shrinks a little bit more. And so you could see her eyes are a lot more open up and there's less hooding on the bottom.
I did see that.
Yeah, so that treatment was called a plasma treatment. So that's what happened through there. And then I think we have some before and afters of each step. So if you go through pulling those up, I can talk you through.
Let's see if I have the correct one here. If not, I'll.
Yes. So this was the before and the after laser resurfacing. So you could see that, you know, even though, and obviously if you could really zoom in on it, there's a lot more deeper wrinkles there, but you could see we really improved even some of the puffiness under the eye.
Yep.
So a lot of people are, you know, they think, well, you know, I have to have my under eye bags surgically cut out of me. Well, sometimes those under eye bags, it's not the bag, it's the space below the bag that's missing some volume. So sometimes we can correct that look by tightening the skin, or, you know, making that tablecloth a little bit thicker and juicier again. And then we go in and we add a little bit of filler into the areas that have lost some fat, and also the areas that support, because sometimes we don't lose all the face fat. It's just that if it loses the support, it tends to sag forward and down, and restoring the areas that are support areas will often reposition the skin and the fat pads so that it looks much more natural, because, you know, people want natural now. They don't want those cheeks and lips that walk in the room 2 hours before the rest of the face.
Yeah, no kidding.
You know that look. And it's like, I know there's a face there, but all I see right now are cheeks and lips. Nobody wants that anymore. In fact, people come into my office and that's the first thing they say to me is, please, don't, you know, if I say filler, they're like, you're going to make me look like that. It's like, no, I'm not, because I don't find that aesthetically attractive, and nobody really wants that anymore.
Yeah, those big puffy lips that some of the Hollywood, they're just unbelievable.
Yeah, I'm not sure when people decided that was attractive. Like, you know, I don't know when, because I never thought it was attractive, but there are obviously people who really do think that is something beautiful, or where the top lip is bigger than the bottom lip, and that's not found in nature. You know, we don't. The top lip is smaller than the bottom lip.
Some guy probably said he liked it.
I think
that started that. And we just heard a ding there. So Sandy, you want to explain?
Oh yeah, what that's all about is that we have to set a timer for us because we never know when to stop talking. So I set it for 15 minutes, and then that tells us it's time to start wrapping up. But we're gonna be here for at least 5 more minutes. And this is so interesting that it might even go longer.
We'll go longer, I think. Okay.
So
We'll go to
I,
the next one, Josie.
Pull up
Oh, I'm
the
sorry,
next
Sandy,
one.
go ahead.
I wanted to say that, you know, Daryl never told me that she was having any of this done over however long period it's been
Oh, right, yeah.
happening. And I never knew it at all, which tells me how subtle the changes were. But now that I see it right next to each other, oh, yes.
Well,
I
we
can see
forget
it.
we forget what we used to look like. I mean, I have, you know, I have stories of people who thought I did too much, and they were like, you know, and during the whole process, I promise, I promise, I promise, and then I actually had somebody come in demanding their money back because, and I'm like, well, why? Well, nobody noticed, and I'm like, oh my god,
Oh, the best possible
What?
result.
nobody, like, did they say, hey, you look like your hair looks good, or did you lose weight, or that's a good
Yeah,
on you?
that's exactly
And I was
it.
doing her before and after pictures, and then I put them up, and then she looked at them and went, oh my God, was that me? So we forget what we looked like, but it was kind of one of those, you're kidding me. Like the whole time I was treating her, she insisted that nobody noticed. And then when
Yeah.
nobody noticed, she was upset.
But you're right about them noticing something is different.
Yeah.
Got your hair cut, or
Yeah.
you lost weight,
Right,
or something
right.
is different, and they never think about that
Right.
when it's so subtle like that. So
Best
let's,
possible result
yeah.
That's really
is
cool.
nobody noticed.
Yeah.
Yeah,
Mhm.
You never want anybody to say, oh my God, what did you do to your
yeah,
face?
yeah, you sure don't.
No, not anymore.
All right, I think we have another one, and now it's possible that I did. Let's see if this is the one you want to look at next.
Yeah, yes. So this is perfect. You got it all. So this photo here shows the progression from after we did the resurfacing. So her skin is much smoother, but then we did restore her cheeks, and you can see how much her under eyes don't really look as puffy.
Yeah.
Because what we did was we restored the mid cheek and the lateral cheek, and we were able to, you know, sort of reposition everything into where it, you know, into a more youthful location. And so, you know, she looks almost angelic in that one, you know. Like
We know differently.
she can be in a museum just sort of staring up there. But that's sort of what the difference is when you know, actually can you know, I sort of call this reconstruction. You know, what I'm really doing is I'm doing restorative work, and I'm using the tools that I use happen to be fillers that are naturally found in our
fillers.
skin anyway. Yeah, they're found in our, you know, most of them are hyaluronic acid fillers, and they're found in our skin anyways. And this whole concern about, you know, Moderna and facial swelling with fillers, yeah, I identified that phenomenon 5 years ago, and it's not specific to Moderna's vaccine. I saw it in a patient of mine who got shingles. She came in, her face was all swollen, and I'm like, what did you, like, first, you know, my sense of humor is like, did you cheat on me? And she's like, no, I woke up this way, and I was so glad I had a Botox appointment. And when I asked her what was different, she had gotten the new shingles vaccine, and her face swelled. So it can happen. It's very treatable. It's not long lasting. It's not life threatening. It's, you know, there's no harm. We can treat it. So, but it is
Sandy, you're scaring Sandy.
yeah. No, but it's not at all. It's completely treatable. And it's just one of these things that it's very rare. I mean, I've probably done almost 6,000 filler treatments in my day, and I had 4 patients who reacted. 4. So we're not talking about a lot of people who have to be concerned.
Got it.
Yeah. And then I think you have one more before. Do we have
No,
one?
I showed 3.
Oh, they're the 3? I thought, okay. I thought we had them all.
But
So
tell me
no,
a
we
little
don't.
bit about this string business.
Too many, Josie.
okay. Too many photos, not enough.
Yeah, for our 20 minutes.
Yeah.
Okay, so you know, we just showed a little bit of something there. We also use certain threads in the practice that can, you know, sometimes you just need a little bit of this, you know, and you need to do this and this without creating a lot of volume. And so there are, you know, they've basically taken surgical threads and they've put these little laser nicks in them to make them grippy. And so when you put them in the skin, it actually, it grips the skin, and you can reposition the skin nicely to give a nice subtle lift. You know, again, it doesn't replace plastic surgery because it doesn't remove excess skin. Although surprisingly enough, there are times when I do it and I see some excess skin and I keep thinking, oh my God, please, they can't have that forever. And it miraculously goes away. So, we have devices that dissolve fat. We've got, sometimes I will, when somebody has a lot of jowl fat, we use a product called Kybella off label to dissolve some jowl fat to sort of allow things to be lifted easier. So there's, a whole lot of tools in my box that I can use that really you walk in, you get treated, you walk out, there's, not a lot of downtime and you just stay looking fresh and youthful and nobody really notices much.
So
Where
cool.
are you located?
I'm in Highland Park. So I'm in downtown Highland Park. Right near, everybody who knows Highland Park says above, you're above Love's Yogurt. So I'm near
Yeah.
Walgreens. I'm above Love's Yogurt and it's considered in the downtown section, 595 Elm Place. And I'm sure you'll probably put that on your website as well.
We will.
But that's kind of where I am.
Cool. And Daryl can tell us where, whoever's listening, where we show up for people to look
Right.
on Facebook.
Not at me.
I'm talking to
Well,
you.
they come look at me too.
You're the host today, kiddo.
All right.
Yes, I think that's pretty much it. We talked, the only thing we didn't really talk about was subnovae, which is plasma. Plasma is everywhere. Whenever you have a little bit of a shock, and somebody touches you and the environment's too dry and you get a
Yeah,
shock,
yeah.
that's plasma energy. So we actually use that as well to help shrink tissue. And Daryl had that done to her upper and lower eyelids.
Oh, yeah.
So, she's got a lot less fold and, hopefully it'll continue to retract. We might have to do just a teeny bit more on the upper lid down the road, but, it's all great if you can't have surgery and, you just want to have less eyelid folds. We can, that's a great area. It's a home run area to treat. We'll treat anything that's skin. So there's just way more tools than I can talk about in my toolbox, but I think we've covered some of the main ones, at least the ones that Daryl's experienced. So she can tell
Is
you.
there ever a time that insurance would pay for something like this?
Insurance will pay for blue light therapy for people who have precancers, but it's the amount of downtime that's associated with that form of BP, it's called PDT, with that form of therapy, often when a patient chooses to have that done, we'll come back if they need more and they'll just have a laser peel instead, because I can control your downtime to 5 days. And when you do PDT, photodynamic therapy, you can be red and swollen for 30 days.
Oh,
so,
boy.
it's, yes, there are, but for the most part, if you can't see because of your eyelid skin,
That's a different thing.
yeah, if you fail your visual field exam, that's where they test to see whether you're able to see, then they will pay for the skin to be removed. But then I've had to do some revisions on people's surgery because the scar can be thick or it didn't sit right or the stitch dropped. So, surgery isn't necessarily great or doesn't necessarily mean that you'll never have anything else done in the area again. But at least there's things to be done if there are issues from surgery too.
Got it.
So all in all, I will say that most of the procedures were very pleasant, and because they were over very quickly, and because she's got tools for that too to make everything go away. You feel you see the results like right away. And the fact is that you don't have that much healing to go through because, again, it's a non-invasive kind of treating yourself. And I have gotten to the point where I'm extremely happy that I was brave enough to do the first one, the second one, the third one. And but it is like every time I go in there, it's like, okay, what do you got now?
You did say stop getting new toys because you know what, this is making me crazy. But I also like to say that Botox is the gateway drug and fillers heroin.
But say that again, Botox is
the gateway drug because it takes a couple of weeks before it sets. So you start off with like this angry brow, and then a couple of weeks later you look happier. Whereas filler, I can inject half your face and show you, and you're like, oh my God, you see it right away. So it's more addicting. I consider it heroin.
Oh, I see what you're saying. Yeah, yeah. So you have to be patient with the Botox is the idea, but it's the better procedure, right?
Well, no, it has a different function. So
Oh,
it relaxes muscle so that you don't, if you're concentrating, you don't have that scowly look, whereas filler,
Yeah, like here.
yeah.
I
That's
maybe I need to come and see you and get rid of those two. Yeah, okay.
But that's it. I don't know. Daryl, did you have any more questions? Did you want me to address anything else? And because I know we're on a time crunch.
No, I just, want everybody to know that there are other ways of doing things. And first of all, it's extremely acceptable. And not only is it acceptable, it's also, it's a treat for yourself. It really is. And it's something that everybody does deserve to get. You don't have to walk around with like this all the time, or you don't have to walk around like, and worry about what you want to do and how you want to do it and just not feeling good, because all of us are in our 70s, except for Josie. And that is not old anymore.
No,
Nope.
you're right. It's not.
And so I think it's not only important because you feel young inside, it's okay to look young on the outside too.
Mhm.
So I give everybody my permission and my blessings to go ahead and do something like this and investigate it. And Josie is one of the best. I will say that. I have to, because she's not paying me, but just because.
You know me a long time, and you wouldn't have kept coming back if you didn't like what I did.
It's clear she knows, your stuff. No question. about
Yes. And I trust her, totally trust her. And I think that that's another thing too, that you really do,
Yeah.
like any doctor that you're going to do or see, that trust is really an important thing. And don't be afraid of it. It's really good.
Good deal. So tell her where we're going to post up the video and when it's live and what else we can say on the Facebook site and so forth.
So you will all see this on Wednesday, and after 12 o'clock, it will drop from the sky onto your screen. And I hope that you will enjoy it. And if you have any questions, we will have all of Josie's information in the little byline that's down there. She's always open for consultation, and even to go in.
Even by Zoom.
That's what she does. And she loves doing it. And that's really one of the most important things, is that she really is an artist when it comes to doing things for you and making sure that you look natural and yet you feel like things are really are beautiful. So cool. I do thank you.
Thank you.
Oh, we all thank you for joining us, Josie. And also we are on Instagram, Just Us Talk Show. And the same thing applies. We'll have a link in the bio that will allow, it doesn't drop out of the sky. Sorry, guys. You have to go click on a link.
I can just appear on your screen.
Oh, so do you think, well, that's my problem lately?
Maybe. And Just Us, Sandy, you can tell us about Facebook.
Yes, the Facebook page is Just Us with Sandra Baskin, Daryl Annisfeld, and Sandy Gulliver. And we hope that you'll follow it, because then you'll get notifications whenever a new episode is ready. Also, all of our past episodes are listed there. And as Daryl said earlier, we are on episode 11. Each episode runs from 20 to 25 minutes. So you've got some good viewing ahead of you. This is if you're just now joining us for the first time, because all of our guests have been as exciting and interesting as Dr. Josie has been.
Yep, agree. And we've noticed that people are going back to some of the episodes in the beginning and watching them. We had several that had 4 or 5 showings just the other day.
Right.
Building Instagram pretty well too. We've got probably close to 1,400 followers now.
That's great.
So you'll get some exposure, and in a way of the only way we can really say thank you for joining us.
Oh, thank you. I mean, yeah, I love Daryl, so it's always a pleasure when she comes in.
Well, we don't like her at all, of course.
We must keep her around for some reason.
Yeah, right. See, somebody will figure that out. We actually love her a lot. We all love each other. And everybody be safe, huh?
Yeah, everyone be safe.
Yeah, wear your masks. Okay, keep it going. We're almost
too.
almost in the home stretch, but
Almost.
Yeah.
Can't
When-
wait.
When we
Gotta
can
hang in
finally
there.
take our mask off, you want to look good.
Yeah, we do.
Right.
Like Josie comes in.
Yeah, we do. All
oh,
right.
that
everybody.
reminds me, my grandson saw me the other day because I've had all my shots
Mhm.
and I didn't have my mask on, and he looked at me and he said, Grammy, I haven't seen your teeth in a really long time.
Oh, isn't that cute?
It really was very funny.
Oh,
Kids,
God,
what kids notice. Yeah.
I know.
Okay, I'm
right.
gonna click us out.
Thank you for inviting me, Daryl, and nice to meet you, ladies.
Nice to meet you too.
Nice to
All
meet
the
you
best.
too, Josie.
All the best.
Adios, everybody.
Yeah, goodbye.
See you till next time.
Bye-bye.